This is a video just showing the x-rays of a patient with a tailbone fracture. So a fracture or broken bone at the coccyx or tailbone. And I'm Dr. Patrick Foy from the website tailbonedoctor.com. And basically what I'm showing here is a x-ray right here. And I kind of have a laser pointer. I'm just on my computer monitor here. But basically the sacrum will be up above, and this will be the coccyx down through here. I'll show you. I'll lead you through step by step through the X-ray. So up above is the sacrum. So the sacrum is up in that area, and that's part of the lower back. After below the lumbar spine is the sacrum, and then the coccyx is the area indicated down through here. To take that further, I've numbered the segments on the coccyx in this particular patient. The patient had 5 coccygeal segments, so I've numbered those 1, 2, 3, 4, 5, as you can see here. So I'm kind of toggling back and forth between showing that with and without the numbers that I have superimposed on there. So those are the 5 coccygeal segments. Some patients have as few as 3 coccygeal bones, some have as many as 5. So there's a lot of variability there. Now I've moved the numbers off of the coccygeal bones just so that we can see the numbers in the bones at the same time here. And I'm going to call your attention here to coccygeal bone number 2, which is the one that I've outlined here with that yellow squarish or rectangular-ish appearance here. So that's the second coccygeal bone, and I could make another video at some point in terms of how we go through numbering them. But for purposes for right now, just take my word for it, that is indeed the second bone of the coccyx, of the coccygeal bony segments. And then down here, now I'm circling or outlining the third coccygeal bone. And now we'll move on to the fourth. And down below, of course, is the fifth. Okay, so you can see those coccygeal bones. The one that I haven't outlined yet is the first coccygeal bone, and we're going to go through that in just a moment. That's right up here. We're shown by the red bracket. And what's going to happen as I start to outline it? First of all, notice coccygeal bone number 2 with the kind of squarish shape, right through here. When I went through, I'm going to go back here just for a moment. Notice how the borders are very clean, well demarcated. It's crystal clear. If you wanted to draw a line around them, as essentially I have electronically here, it's very clear cut where the edges are, and they form a nice, smooth, appearing shape. Nice crisp borders all the way around, and the same is true of the other coccygeal bones below. But as I come up here to coccygeal bone number 1 in this particular patient, as I try to draw the outline, first of all, let me try honing in a little closer here, and let me see if I can focus out a little better on that portion. Okay, so basically as I try to outline that, one of the things you'll see is there's this lower segment down here that just does not look right. There's not a nice, one crisp, clean joint for the bone there where it meets with the next bone. It sort of looks like you'd have to question yourself as to which is the bony articulation, the dashed line above or below. And then as I come up on the right side of the image here, I've drawn this little red line. That's actually the front of the coccyx. By the way, just in terms of referencing here, the left side of the screen would be, behind the patient, and the right side, of the screen would be inside the patient's pelvis, would be in there, and to the left would be outside of the patient, and the skin would sit right there, kind of right where the numbers are in this particular demonstration. Anyway, I'm going to come back in here a bit, and again, just looking at now where I've made that red line here. And notice how at the top of that red line it all gets a little broken down because you don't have a nice smooth area where the bone is going to next. In fact, as I've drawn it in green here, the borders sort of become very irregular, and it sort of becomes not so clean and crisp to make a nice well demarcated shape the way that we were in those lower coccygeal bony segments. So that is because the patient had a fracture at that first coccygeal segment. Okay, so I'm going to take I've taken all my marks away, and again you can see how irregular that first coccygeal bone is in this particular patient. This is what you might expect that it should look like. If this patient had not had a fracture, you would expect the first coccygeal bone to be taller or larger than the next one. It's typically the way that it works. They get smaller and smaller as you go down the line, as you can see with the rest of those. And bony segment number 1, had there been no fracture, would probably look something like the rectangular shape that I've superimposed there. But you can see that indeed it does not. So what's happening is, where I've drawn the red line here, there's a fracture through that region. And it's almost as if you crushed a cup, and I'll show you what I mean by that. Bear with me for a moment. The screen may go blank for just a second, and I'm just going to flip on a light here. I'm actually just doing this here in my office, sort of end of the day type of thing. So basically, if you had a cup, if that was the supposed to be that first coccygeal bone end, if we were to sort of imagine that cup got sort of crushed and indented, so that this segment got indented in, giving you this portion here, and another segment got indented in, giving you that portion there. That would sort of be, if I can do this with one hand while holding the camera with the other, it'd sort of be crushed in like that. And then the segment in the upper right corner would be crushed in a bit as well. So again, you can sort of see how that plays out, on this particular spot right here. That first bony segment, again, just sort of crushed, which can happen as a result of trauma, falling on the tailbone, etc. All right, so we're going to go on to just a couple of different images. And here, again, same patient, but again, but a different X-ray. And here, again, we'll call your attention to that first bone of the coccyx. Here's bones 2, 3, 4, and 5. But that first bone of the coccyx, you can again see how irregular it is because of the fracture that's through that spot. Okay, and here, yet another image, another X-ray, same patient. Again, you can see bones 2, 3, 4, 5 is a little washed out, but that's fine for our purposes. We're most interested right now in segment number 1, which is right up here. And again, you can see that fracture line going right through there. Again, same patient, another image. Again, coccyx bony segment number 1, and the fracture line going through. A couple of quick notes, certainly just to remind you, this video is purely for educational purposes. This is not meant to be patient care. This is not medical advice. If you're viewing this video, certainly my recommendation is that if you're having tailbone pain, you should see a healthcare professional, see a physician, ideally somebody with experience in treating tailbone pain. If you want more information, feel free to check out my website, which is www.tailbonedoctor.com, and thank you for your interest.